Hello again, my name is Ernest Minu. Let's settle for the details now. The Ashanti Regional Directorate says some COVID-19 vaccines in stock have expired due to public hesitancy to take the jab. Though the number of vaccines expiring are not made available, the Directorate is not enthused with the apathy to get vaccinated. Nana Yaljima has more in the following report.
To achieve herd immunity, 70% of the population in the Ashanti region should be vaccinated. So far, 42% of persons in the region are vaccinated. A number of the population are partially vaccinated. This is a cause of worry to Dr. Emmanuel Tenkran.
Every vaccine has its own expiry date. So if you keep the vaccine and you don't use it, at the end of the day, it will expire. So sincerely, we've had some vaccines expiring because people didn't come for the vaccination. Ideally, no vaccine should expire because we don't have any reason. The vaccines are so expensive. So even if one vial expires, it's a concern because you know how much it costs to produce a vaccine. So for me, it's not the quantum, but the fact that we are not expecting even one vaccine to expire. And that's what we are trying to address.
Presently, Ashanti region has no COVID-19 case. Nonetheless, the Health Directorate believes until herd immunity is achieved, the region cannot tout the achievement.
We need to have at least minimum of 70% coverage for the vaccination before you can say that at least we've achieved that herd immunity, which will prevent a further outbreak. But we've not gotten there, despite the fact that the government has given us all the resources. We have the vaccines, we have the human resource, we have the equipment, we have the logistics. I think the major challenge is that of vaccine hesitancy, because there has been a lot of misconception, fear, and then myth surrounding the vaccination. And that's the reason why I think we've met here. We believe that Ghana Health Service cannot do it alone. We need more partnership, people who are trained in social mobilization and then advocacy and then communication so that they can take the message down there. So we engage a number of partners.
Through the Pact 2.0 project of the Hope for Future Foundation, 3,854 people in the country are vaccinated, with females dominating the figure by 2,473. A total of 7,466 persons had accepted to be vaccinated. Young Health Advocates of Ghana and the Red Cross were partners. Catherine Bentum Williams is project coordinator.
The goal of our project was to get a lot of people to take the vaccine and also reduce the myth and misconception. I would say that the partners were really helpful and we all coordinated properly, and so we're able to exceed our target. And for me, my role as the project coordinator, I brought all partners together as well as the champions and all stakeholders. So there was effective communication, engagement with all partners. So at the end of the day, we were able to identify the gaps earlier, and identifying the gaps, we were able to put up mitigating measures for us to address these challenges, and then these helped us to achieve our targets. And
for Joy News, Nana Yaljima reporting.
Some good news coming in there, but let's return to our earlier story where the Ashanti Regional Directorate says some COVID-19 vaccines in stock have expired due to public hesitancy to take the jab. The Directorate says though a number of vaccines expiring are not made available, it is not enthused with the apathy to get vaccinated. Let's go to the phone lines now and speak to Director of Public Health at the Ghana Health Service, Dr. Franklin Esiedu-Bekwin. Doc, I'm grateful that you could speak to us. First of all, let's start with your reaction to the situation in the Ashanti region. They have been compelled to dispose of some of the vaccines because people are just not interested in getting the jabs. How do you react to that?
Thank you very much. And good morning to your listeners. So let me state that it's about in terms of proportion. I mean, if you look at the vaccine drive that we've had in the country, I think by the record we have had over 90 million doses being administered. Every vaccine has actually a shelf life, and it all depends on the kind of storage that you have. So I don't have the full report here, but there with some few vaccines that have expired because it depends on when you had the vaccine and how long you're going to use them. But I think if you look at the country's performance over the period, you can clearly see that almost 50% of Ghanaians have actually received at least a dose. Number 32% are fully vaccinated. I would say it's a bit of slow and at times it picks up. So we design a number of strategies to make sure that we get Ghanaians vaccinated. I think that we are, of course, I can't speak offhand how many vaccines have expired, but it's not that much compared to the number of vaccines that we have used.
Right. Before we move into the strategy that you're rolling out, kindly reiterate the point for me. You're saying that 50% have taken the jabs and more than 70%.
No. What I'm saying is that about 50% of the targeted population have had at least a dose.
Right.
And about 32% are fully vaccinated. So that is the coverage at the national level. You know, if you look at our target, we're looking at 15 years and above and pregnant women. So that gives you a certain proportion of Ghanaians who are eligible. Other countries use 5 years and above. But we, for now, our use authorization of the vaccine is 15 years and above.
And so what are we doing? Is the apathy we are seeing as a result of the perhaps, the failure on your part to increase the awareness, a slowdown in the campaign? Could that be the reason?
I don't think you should use the word failure. There's nothing like failure here. You see, if you look at the current polio campaign which is being done, you realize that the coverages are very impressive. Ghana is one of the countries that has a very impressive vaccine program in Africa, not just in West Africa, in Africa. COVID-19 has its own unique challenges because of the various myths that came about. And that's how come we use several strategies using influencers like you yourself to make sure that the Ghanaians understand the import of getting vaccinated. So it's a collective effort of getting Ghanaians to appreciate. And I can say that if you look at the map of Ghana and you want to look at it by coverages, you can see that there has been a gradual improvement in terms of coverages. We had a few districts that had their own challenges. That's why I come last month in particular. We actually mobilized MPs, members of parliament, to go into their constituencies to get people to appreciate the import of getting the vaccine. So it is not a Ghana ourselves approach. It's a whole of Ghana approach to get Ghanaians vaccinated. And I want us to have that thing well clear that the fight against COVID is not Ghana ourselves. It's a whole momentum, a whole society approach.
What is the timeline we are working with right now? I know that as of last year, the president had said that 20 million by end of the year. This year, what is the target that we are working? Of course, we could not achieve that because of the circumstances. What are we working towards right now?
Yes, as I said, we have crossed the 19 million. Hopefully, we will get a campaign done next month. What we are doing is that we are using two strategies. We are using the campaign and the routine. So now you can just walk into any government facility any time of the day, and then you get vaccinated. And then once in a month, we do a campaign whereby we do close to client approaches. So that's what is being done. And as much as possible, we are trying to make sure that the Ghanaian gets it. We hopefully will we'll cross the 20 million somewhere next month. And then we'll still get more Ghanaians vaccinated. What we are doing now, we are also going to try and lower the age. We are engaging the NITAC if we get approval. So in that case, persons 5 years and above will also be eligible to get vaccinated. That's what is happening in Europe and the Americas.
Right. Dr. Franklin Asiedibekun, I'm grateful that you could speak to us this morning. That's the Director of Public Health at the Ghana Health Service.